Our next module considers why people make certain health decisions. In this module, you'll be introduced to different models of health behavior change, which you can consider while going through different topics such as exercise and nutrition, drinking and drug use, or when dealing with a chronic disease. You're halfway through this class. Think about your personal decisions on health. Why have you chosen to ignore a symptom instead of going to the doctor? Or what helps you to keep a New Year's resolution for eating better and working out? Why did you decide you were not at risk when driving after having a few drinks? Or what kept you working or working out when your doctor told you that you needed to rest? This module will help you consider factors for why these things happen. I know you'll find it personally interesting, but for many of you, the models of health behavior change are very important for your career. You may tell an athlete to stretch and ice an injury, but will they do it? You may tell a patient they have to lose weight, but how can you assess their likelihood of doing this? To help you consider the psychological and social aspects influencing health, you will first learn about 3 important models of health behavior change, and then we'll have to continually apply these as well as the biopsychosocial model and consider contextual factors for specific topics outlined in topic 7 through 9. For the topics of this module, you'll be applying these models to a variety of health-related concerns in America and addressing the same learning objective, which is to illustrate how the application of health behavior change models helps with health psychologists with health-related topics using theoretical and empirical justification. In this first topic, you will have a portion of Chapter 6 to read, a health profile, and a quiz. I've also provided a brief mini-lecture on health behavior models. You'll be applying these models to a chronic illness, so be sure you're carefully considering the models as you read about them and how they differ. There are chapters in your book covering cancer, diabetes, and cardiovascular disease. You can choose one of these topics based on your personal interests. You only have to choose one of these 3 topics. With this, you need to answer the following health profile. How do models of health behavior change in the biopsychosocial framework explain disease progression for the disease of your choice? One empirical article must be included with the information presented in the textbook to support your discussion. Topics 8 and 9 on nutrition and exercise and substance use and abuse are very similar in your assignments. You will have a video and a worksheet to help you practice applying concepts you read about in the textbook. You have a peer post due for topic 9 on substance use in college students. Please discuss this topic in general and don't refer to your personal use for your own protection. Topic 8 is a journal entry and 9 is a discussion post and requires peer comments. For each of these health profiles, you are required to discuss aspects of each part of a model, such as perceived vulnerability, self-efficacy, etc. Provide one research study you find that's a primary resource you find in an academic journal that supports your position and experience. For your third module assignment, you will need to interview someone on a health behavior change that they have attempted or achieved. You will need to apply topics from Module 3, so start to think about who you want to interview and jot down questions you think would be good to ask. Check out Blackboard for all the information you need to complete this assignment, and don't forget to look at the rubric. You need to choose one of the models described in Chapter 6 to evaluate your interviewee's experience. So as you read this chapter, mentally apply each model to different people's experiences, or your own, to help you make the components of the model meaningful. Here are the 3 models again that you'll be continually applying throughout this module and also for your module assignment: the health belief model, theory of planned behavior, and trans-theoretical model. I hope you find them both personally and professionally relevant. You are well on your way to finishing up this semester. Please contact me if you have any questions.